When you hear the term PTSD, you immediately think of people who have been in Iraq or Afghanistan and the horrific things they have dealt with. Almost everyone lives through something traumatic at some point in life. Most people have a lot of distress right after a trauma happens but begin to feel better over time. For other people, the pain continues, and they begin to have symptoms that impact their lives. Sometimes, we escape with no long-term effects. But, for millions of people, those experiences linger, causing symptoms like flashbacks, nightmares, and negative thoughts that interfere with everyday life. In this video, we will discuss why should we worry about post-traumatic stress disorder, who it can affect, and how to get help. But first, you have to know, what is post-traumatic stress disorder, PTSD? Post-traumatic stress disorder (PTSD) is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Symptoms can persist for months, or even years after the original trauma. PTSD is considered a serious mental health condition and can be difficult to diagnose. Most people who go through traumatic events may have temporary difficulty adjusting and coping, but with time and good self-care they usually get better. If the symptoms get worse, last for months or even years, and interfere with your day-to-day functioning. Now let's talk about the symptoms. PTSD symptoms are generally grouped into 4 types. Number 1. Intrusive memories. PTSD is a psychiatric disorder that can develop after exposure to intrusive memories are one of the most common symptoms of PTSD. Intrusive memories are memories that are constantly returned to and cause distress. They can be anything from a specific event to a feeling or thought. Symptoms of intrusive memories may include recurrent, unwanted, distressing memories of the traumatic event, reliving the traumatic event as if it were happening again, flashbacks, upsetting dreams or nightmares about the traumatic event, severe emotional distress or physical reactions to something that reminds you of the traumatic event. Number 2. Avoidance. There are a number of traumatic experiences that can lead to PTSD symptoms. Intrusive avoidance is one of the most common symptoms, and it refers to a persistent fear or anxiety around certain stimuli or situations. This can be extremely debilitating for people who experience it. Symptoms of avoidance may include trying to avoid thinking or talking about the traumatic event. Avoid places, activities, or people that remind you of the traumatic event. Number 3. Negative changes in thinking and mood. PTSD symptoms can include negative changes in thinking and mood. One of the most common symptoms of PTSD is paranoia, which is characterized by a feeling that people are out to get you. Other symptoms of PTSD include increased anxiety, anger, and depression. Negative changes in thinking and mood are one of the most common long-term effects of PTSD. Number 4. Changes in physical and emotional reactions. People who have PTSD may also have changes in their physical reactions to stress, such as becoming agitated or having a rapid heartbeat. In some cases, people with PTSD may also experience changes in their emotional reactions, such as feeling tearful or out of control. Symptoms of changes in physical and emotional reactions may include being easily startled or frightened, always being on guard for danger, self-destructive behavior, such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritability, angry outbursts, or aggressive behavior, overwhelming guilt or shame. PTSD symptoms can vary in intensity over time. You may have more PTSD symptoms when you're stressed in general, or when you come across reminders of what you went through. For example, you may hear a car backfire and relive combat experiences. Or you may see a report on the news about a sexual assault and feel overcome by memories of your own assault. It is important to note that PTSD can affect anyone, regardless of their age, sex, or location. There are a few steps to get away from it. First, talk to someone about your feelings. Talking about your experiences can be helpful in relieving tension and stress. You may also want to consider seeking professional help. Secondly, identify triggers. Triggers could be anything that reminds you of the traumatic events. Be aware of what brings on the symptoms of PTSD and try to avoid those things as much as possible. Thirdly, take action steps. Doing something physical or mental often helps reduce anxiety and stress levels. PTSD doesn't have to last forever. People go on to live happy, peaceful, fulfilling lives, and the future looks hopeful again. Stay healthy and stay with health conscious.